Live from Eyewitness News, this is breaking news.
And right now, Governor Raimondo is giving her daily update on Rhode Island's coronavirus response. We want to listen in live at the Department of Administration.
For those of you who celebrate St. Joseph's Day, as we do in my family, thank you all for tuning in. This is definitely the best place for you to find accurate and up-to-date information, and it's our goal to keep everybody informed, because if you have information, that's power. Time is not our friend, information is. Fear is not our friend, facts are. So try to avoid some of the rumors you're hearing on social media. Certainly avoid any of the offers that you're getting on social media around magic cures for the virus or hand sanitizer that's good for 48 hours. And just continue to tune in here and to the Department of Health website, and we're going to get you all the information that you need in order to get through this. As per usual, what we're going to do is I'll make a few comments and a few announcements. Then I'll turn it over to Dr. Nicole Alexander-Scott, and then I will come back to start answer questions. We have 11 new cases of coronavirus since yesterday, and the doctor will handle all of those details. I would like to begin by reminding Rhode Islanders that this right now is absolutely the most critical time. Many people are saying to me, you know, is this the way it's going to be indefinitely? The answer is no. The thing that I am most, focused on is getting us to a place where we can reopen the economy. I know this is crushing, but right now we're a step ahead of the virus, and right now we're not overwhelmed. We never want to get to be overwhelmed. And so if we do the very best we can right now in the next couple of weeks to really shut it down and drive down the rate of infections, then that helps everybody to get more quickly to recovery. Why am I beginning with that? Because it's hard. It's hard to stay home. You know, it's hard. It's difficult to get your work done in your house with your kids home. It's difficult to get behind in your work, and I hear that, but we pay now or we pay later, and the price now is much lower. So I'm asking you for your patience and for your cooperation, and I'm asking you to just hang tight with us, get in the boat, and row in the same direction. The most common question that I'm receiving at the moment is, will I order a shelter in place, as you're seeing in other cities and states? And the answer is no. I am not planning to do that, and I want to avoid that. That would be truly crushing to our economy. The only way we're going to avoid that is if everybody right now follows the directions that we're giving, avoiding crowds, people 60 and older staying in the house, washing your hands constantly, and absolutely staying home if you're sick. If we do that, we'll get through this much more quickly. But the answer to all of those wondering, are we going to order shelter in place, is no. No plans to do it at this time. At the moment, we are working for the best, but planning for the worst. Planning for the worst means all of our planning is focused on a surge. How do we have extra capacity for quarantines, extra capacity for hospitalizations, extra capacity to help folks who are out of work? So we are planning for the worst, and that planning is going very well, but we're working for the best, and right now that work is paying off. Thankfully, we are not in a situation like you see, for example, in Seattle, Washington, and we want to stay that way. A few specific things. As I said from the beginning, we're going to take this a day at a time, a week at a time. The focus of today, we've been working furiously since very, very early this morning and late last night very focused on getting our hands on swabs, the kind of swabs that we need so we can ramp up our testing, as well as the what's called PPE, personal protective equipment for healthcare workers. N95 masks, gloves, gowns, face masks, ventilators, and the like. Unfortunately, the federal government's response to this has been lacking, and so I'm not standing still. We're motivating ourselves, reaching out ourselves on a one-by-one basis to manufacturers, to distributors here in Rhode Island and all over the country. To that point, I am putting a call out to all the people of Rhode Island to give us a hand. If you are a manufacturer who manufactures any sort of textiles, we need to hear from you. If you are a manufacturer whose employees typically wear any kind of masks, we need to hear from you. Maybe we can tap into your vendors and suppliers. Maybe you have some in the manufacturing facility you can give to us. If you operate a lab, we need to hear from you. If you're a researcher in industry or in academia, we need to hear from you. If you're a dentist, you might have the kind of swabs that we need to hear from you. If you're a distributor of medical supplies, we need to hear from you. So, and by the way, we've been putting this call out. Commerce Secretary Pryor has been in daily contact in a fantastic way with businesses, but I'm making a more official, broad call for businesses and labs and dentists and healthcare professionals in Rhode Island, and I'm asking you to answer that call. I have been assured by the federal government that, a week from now, this will be different. They're ramping up their supply, they're ramping up their manufacturing, but right now, I'm calling on the people of Rhode Island to step up. By 3 o'clock today, there will be a section on the Department of Health's website. By 3 o'clock today, there's a page on the Department of Health's website which will detail exactly what we're looking for, pictures and specs of the kinds of swabs, masks, gloves, goggles, gowns that we need. So this afternoon, take a look at it and let us know if you think you can help. To those of you who've already stepped up, thank you. It's an unbelievable thing. We have dentists showing up giving us 600 swabs. I've heard of school kids reaching out to their lab, to their science teachers, asking if they have, swabs in the high school laboratories. That's the spirit we all need to have. I know this is really hard, and I'm asking for a lot of sacrifice, but at the same time, I'm asking you to ask yourself, how can I help? Now, having said that, the response from most Rhode Islanders is great, and what we're seeing by most people is generosity and kindness and patience. The crisis is bringing out the best in most people. It's also, unfortunately, true that the crisis is bringing out the worst in a few others. Specifically, we've heard from the Attorney General, who's been a terrific partner in this, that we're seeing more instances of price gouging. So the message that we have and that the Attorney General has is that price gouging is illegal. So as a consumer, you should know that. So if you're trying to place orders of anything, any item that you might be used to buying, water, hand sanitizer, anything, and you're seeing a skyrocketing of that price, you need to let us know. And you can either call the governor's office or better to reach out to the Attorney General, their consumer division. They have their eye on this price gouging. They are not going to tolerate it. So if you're doing it now, knock it off, because it's not right, it's not fair, and by the way, it's illegal. And if you're a Rhode Islander who's seeing it, hey, all of a sudden this is 10 times as expensive as it's supposed to be, You have rights, and we need to hear from you. I also want to make a special mention about banks. We are hearing from some folks that they are concerned about whether they're going to have continued access to their banking. This is one area I want to be very reassuring and very clear, and I have total confidence. Banks and credit unions in Rhode Island and across the country have a lot of cash, a lot of capital. They are in the best financial shape that they've been in a very long time. So just set your fears aside. If you need to get money, we're asking you that you do that through an ATM rather than going into a lobby. Take out what you need. Try to avoid the lobby situation. If you have to go in, please do it by appointment. We've been Commerce Secretary Pryor's been in touch with pretty much all of the local banks and credit unions. They're all operating. They're all in great financial shape. And they're available to you, but they ask that you please call for an appointment. Don't just show up. And if you can, use a drive-through or an ATM. We are hearing a lot from people about evictions. Obviously, unemployment is skyrocketing. We hope that that is temporary, but it is what it is now, and folks still have to pay the bills. So in this regard, I also want to calm people down a little bit. You're not going to be evicted. How do I know that? Because the Rhode Island Supreme Court, led by Chief Justice Sattel, has taken great action and leadership, and they have shut the courts until April 17th for any adjudication of anything related to eviction. The courts are really operating on a emergency basis only. So if you need to access the courts for a restraining order or something of an emergency nature, you should do that. But I want you to know, even if you've received an eviction notice, don't worry about it, because that has to go through a court process, and that will not happen between now and April 17th. I realize that is not a permanent solution. Back to the theme that we're doing this a day at a time and a week at a time. We are working hard here. We're especially working with the federal government on this, and we'll be back the coming days or week with some more information around longer-term relief as it relates to mortgages and rent payments. But right now, if you got an eviction notice, take a breath, stay in your house, and have confidence that between now and April 17th, it can't go through the procedure that's required to make it effective. Nursing homes. I want everybody to listen around nursing homes. We know this virus hits the elderly the hardest. Again, look at what's happening around the world and even around this country. The places that are in the worst shape are the places where the outbreaks are in nursing homes. We have ordered, actually, the Department of Health has ordered no visitation by family members to nursing homes. This isn't a joke. It's not a joke. We're hearing way too many stories and seeing way too many Facebook posts of people sneaking into nursing homes, going up to the window of their elderly loved one in a nursing home, blowing kisses through the window, touching through the window. I don't know how else to say it. You're endangering the life of your loved one and everybody else in Rhode Island. Nobody wants to be in this situation. Nobody wants to be in this situation for a minute longer than we have to. The only way we're going to get through it is if everybody follows the rules. And the quicker we do, the quicker we'll get out of it. So please, this isn't a joke. We're not doing this because it's a joke. We're not doing this because we want to make your life difficult. By the way, I know it's difficult. You know, I haven't seen my own mother, who I typically visit her every day. I haven't seen her since I've been dealing with this. It's really hard. I call her on the phone. But I'm just asking you, to help us out, do the right thing, and stay out of nursing homes. A couple other messages that we are hearing about. Yesterday, we made a huge announcement about schools. I want to tell everybody that folks are working hard. Teachers are awesome. They're getting on it. They're working already. We're getting lots of creative ideas. Students, we need you too. We need you too. You got to get up on time next week. It's regular school. Get to work and, do the assignments and help us out. But as I said yesterday, I don't want to throw in the towel. We want our kids to learn. And we're going to go to distance learning for everybody starting Monday. Utilities, I announced yesterday, but we're hearing a lot about it, so I want to announce it again. The Public Utilities Commission has ordered that all regulated utilities, gas, water, electricity, cannot be shut off as we deal with this crisis on account of your inability to pay. You cannot be charged late fees for being delayed. So again, there's so much stress right now. That's one stress. Just take it off your plate. I want to make a special thank you to Cox Communication. After seeing yesterday's press conference, Cox reached out to us. They made a $35,000 donation to the Department of Education to help us with distance learning. And they've agreed to not cut off service and to waive any late fees to customers who can't pay their bill on account during the period of the crisis. So I want to thank Cox for that and really appreciate that because everybody needs to be informed. And to all of the businesses who are stepping up, thank you, every single one of you. I announced a philanthropic effort 2 days ago. We're well over $2 million. We need more. Keep it coming. To everybody who's in the boat, rowing in the same direction, thank you. We're going to get to recovery. Everyone wants a date. I don't know the date. Anyone who's telling you a date, I don't think is being straight with you. So what we're doing is we're trying to put a lid on it, and then we're going to look at, I'm going to have my eye on certain metrics, certain criteria for when we can reopen things. How many tests can we do a day? How many new cases do we have in a day? How many extra hospital beds do we have? How many people can we effectively quarantine at once? And once I start to see us moving in that, hitting those marks that we need to hit, then that's when we can start to think about going back to a more normal lifestyle. But I will tell you this, the speed with which we get there depends on what you do right now in the next couple weeks. So with that, I'm going to turn it over to Dr. Nicole Alexander-Scott, and then I'll come back for questions.
Thank you, Governor. Good afternoon. I also want to add to what the governor said by thanking the Attorney General for his leadership on the price gouging issue. The governor has been talking a lot over the last few days about Rhode Islanders coming together. We are seeing that example again and again. That's how we can be confident that we will get through this together. We have been contacted over the last few days by numerous people looking to help, from healthcare organizations to manufacturers, those who have lab supplies, as well as those who have access to personal protective equipment that they want to help make available to the state. I want to echo what the governor said in saying that we are extremely appreciative of these efforts. We want to be able to receive these offers and assess them in a coordinated and streamlined way. So with thanks to BJ Kumar, who runs our IT for the state, we will have active the online form that you can go to be able to see what exactly is needed, both for laboratory supplies as well as for personal protective equipment, and then fill out the information that will tell us what you have access to and where it's ordered from or where it's manufactured from, so that we can get back in touch with you. The website that we will have for you is a separate one from our current website, and we will be including it in the press release. It is bit.ly/COVID-19-MSD. A large number of people have worked very hard on making this available for you for today so that we can continue to receive this welcomed and appreciated outpouring of care. If you have already contacted us and have had a desire to provide some of the supplies, whether laboratory supplies or personal protective equipment, once this website is up and running, which it is and will be, please still use that form so that we can collect the information through that form. The materials that we are talking about are what's being used to help us stay in front of this every day. We're good for today, but we appreciate very much having this outpouring of response to help us stay in front. The swabs, for example, that have been discussed are not just normal swabs with cotton on the end of it. These are specific ones that are needed to obtain nasal pharyngeal and oral pharyngeal specimens for an accurate test. So that's why this website will be very helpful for people to see exactly what's needed and to be able to provide that information. It's great news. It's a perfect example of how Rhode Islanders are working together, and we're happy to get it out to you. So I want to walk us through the data quickly. We have 11 new cases, and that brings our case count to 44. These people range in age from their 20s to their 60s. We know that in this group, people have traveled to New York and to Utah. Of these 11 people, 1 is hospitalized. As I mentioned yesterday, we are continuing to run expedited tests at Rhode's state health laboratories for the highest risk populations. That is hospitalized patients, nursing home residents or other congregate settings, and healthcare providers, including EMS. For that reason, we are not surprised when we hear about hospitalized patients during these updates. We are still investigating each of these new 11 cases and absolutely conducting the extensive contact tracing work that occurs with each case that we know makes a difference in helping to contain this virus. I also want to address a second data issue. Since we saw our first COVID-19 case on March 1st, we have received questions regularly about which cities and towns people live in who have tested positive. Public health is about keeping people informed, but we also have a responsibility to balance this with the privacy expectations and rights of patients and families. That is why early on we have not been releasing information on place of residence. We now have more cases, so that will allow for more anonymity with each of these announcements. And we will be able to do a better job continuing to protect the privacy and rights of the patients and families. So in the coming days, we will start releasing data at the county level. We understand that this is an approach that other states are taking, and that this is something that many have been interested in seeing for Rhode Island. We want to make sure that we are comfortable, when we have the number of cases, to be able to do that in a safe and responsible way. We could get to the point where we start releasing information at the city and town level in the same way that we release aggregate numbers that are greater than 5 for overdoses in cities and towns. However, I want to stress that this is a public health emergency that we are responding to as one state. Rhode Islanders coming together. We know that Rhode Island is obviously very small, and borders between adjacent cities and towns and counties actually don't mean anything to a virus like this. So while that number will be made available, we want to caution you against reading too much into that data versus our statewide data that we will continue to share. Beyond that, I really just want to reiterate some of the messaging we have been talking about for a few days. It continues to be critical for people to avoid crowds right now of any kind. The easiest way to do that is to stay home if possible. If you can work from home, that is great. If you have to be at work, distance yourself from people, wash your hands frequently, and then head home. If you are sick or have symptoms of illness, please do not go to work, do not go to school. We will continue to reiterate the importance of this. The virus spreads through illness and through symptoms being passed on from one person to another. That is how the virus continues to survive. So the more we can limit the virus being passed on to someone else, the more we're able to, as the governor said, put a lid on this to keep it under control for us as a state. This guidance is critical, as we have been mentioning, for older adults and for persons with underlying medical conditions. If you are sick, stay away from others, stay home. If there are others in your home, please do your best to stay away from them within your home settings. The Centers for Disease Control and Prevention has guidance for people who are ill and staying home on steps you can take to minimize getting someone else in your home sick. This guidance is true whether it's COVID-19, whether it's the flu, or another type of virus. As much as possible, you can stay in a specific room. Consider that the room for the person who is not feeling well, and stay away from other people in your home. If it's possible, you can use a separate bathroom where it's available. If there's one kitchen, you can take turns so that when the person not feeling well is able to, they can go to the kitchen and the other people stay in a different room. There are ways to be creative that go along with what we're saying, which is wash your hands frequently, use good cough etiquette, and making sure for sure that you're staying home. We know that we are asking for a lot, but we're asking everyone to do this because it's the best way to help Rhode Island as a state. All those who are quarantining, all those who are staying home, please know it is making a difference. The best way for us to put a lid on this is for everyone to follow the recommendations that are being stated. With that, I'm going to stop and pass it back to the governor to get us started with questions. Thank you.
Thank you, Nicole.
We've been hearing from several people who say they've been tested many days ago, and they've been waiting 3, 4, in some cases 5 days to get their tests back. But we've also heard that hospital-based testing might be something that's happening. So can you just talk about what the delays are and how you're working to fix that?
So I'm going to have the doctor answer that. We'll take a few questions from you guys, then a few questions that have been sent in, and then a few questions from you.
So thank you for that. We have been focused on making sure that we have the influx of supplies that are needed to maintain the ability to do the expanded testing that's needed. Because of the limited resource, the governor has been amazing in pushing extremely hard, keeping Rhode Island at the forefront of making sure we receive the supplies that we need from our federal government partners. In the meanwhile, we have focused our testing results on those prioritized populations because we have to make sure that our healthcare workers are getting their tests turned around quickly, the hospitalized patients where personal protective equipment needs to continue to be used, as well as our congregate setting patients, including the nursing homes. So we have made it so that those patients that are healthy enough to recover at home are still getting their tests, but the time frame had been expanded so that we could focus on the prioritized ones.
Dr. Scott, what's the backlog? Is there a number for the backlog of tests that you have material for but you haven't been able to do yet?
We are making sure that all tests are being run, so there isn't a backlog on them, but we have moved up the ones that are the high priority ones, and we're already starting to get the results of the ones that we had to continue, but move to the side to continue the prioritized ones. So that's why there is a little bit of a delay, but those numbers are coming in. And the treatment is still the same. And so the message for those people who are waiting for the results is to continue to recover safely at home, make sure to stay home if you are ill, and that's regardless of if it's the flu, which we are continuing to see out there, or COVID-19.
So can you clarify for the public? The advice is that the treatment is the same, but isn't also the purpose of the testing to identify people who have it and then to let other direct contacts know that they should self-quarantine, whether that's a student in a school, a staffer at a school, someone at a workplace. So if there's a lag in the test results and you're just focused on priority, there could be a lag there with people then being moved to self-quarantine as opposed to just the generic suggestions? And do you actually have the capacity to test more? I think earlier you said you could do 80 a day. Are you doing that many?
So to answer the first part, the overall messaging we're saying still applies. We want everyone to monitor themselves for symptoms and to stay home. The purpose of quarantining is to stay home and to be able to self-monitor. So that message is being told across the board. People should only be going out if they have essential needs that they need to address. And if they have symptoms, they should not be going out. That is the same message we give to people who are quarantined, that they should actually not be going out and they should be monitoring for symptoms.
Dr.
The number of tests that we are testing at the State Health Laboratory has expanded significantly for that prioritized population. We are working with commercial labs and hospital labs to be able to expand it even further to respond to some of the additional tests in the populations beyond the prioritized ones that I have mentioned.
Dr. Are the 44 cases spread among all 5 counties in the state? Is it in all corners of Rhode Island at this point?
There is no preference of county for this virus. We are receiving it from throughout, and as we start to release the data, we'll be able to share that information more definitively with you, Steve. Yes.
What is the situation with the ACI?
Our interaction with the ACI is similar to how we conduct any evaluations at any time. If there are concerns about illness, the ACI works very closely with us in addressing it, understanding, and testing. We are working through that right now. We do not have any cases at the ACI at this time. That information is updated to say that we do not have cases at the ACI at this time.
What kinds of procedures do the correctional officers go through to get in and out? Because I've heard concerns about that as well.
That's something that we are working with on the ACI in terms of making sure that they have the infection control procedures and practices that would be recommended, whether it's COVID-19, influenza, hepatitis. Those are ones that we want to make sure that the correctional officers and the ACI, the medical director there, Jennifer Clark, is excellent. We work very closely with them to make sure that they have the information they need to protect the officers as well as the inmates.
Have there been cases there that have been moved out to other hospital settings perhaps, or at the ACI? We had heard too that there were people there with the virus that's not, where they moved out?
I am not aware of any other changes. Our team works very closely with them to address what is needed
You have no reports of
any
infection
positive
at
cases.
the AC. Thank you.
Question from the side of the room?
Yes,
Let me, oh, go ahead. Then I was going to do.
it might be for the doctor as
Yeah.
well, but just, can you clarify when you talk about the prioritized populations, do people need to be displaying all of the symptoms, one of the symptoms? We get a lot of questions from people who are wondering, what that threshold is.
We determine that as long as we know that you're a part of that prioritized population. We assess the qualifications, and it's not just one or it's not requiring all. If we have a healthcare worker that we have concerns about and we know the risk that's in place, we will work with them to make sure the testing is addressed.
And can you clarify how the testing is administered? I mean, are people, we don't have widespread drive-up opportunities at this point, or can you clarify how these tests are administered?
As the governor mentioned, we are one of the first states to have had the drive-through testing capacity that was in place. For these prioritized populations, most of them are already connected to a facility where they can have the testing obtained. So if there is someone who isn't, we certainly have the drive-through testing capacity, sampling site capacity available to them.
Just one for the governor. If I may.
Like Uber driver, we know one from, I don't want to say the city, is infected and the hospital in Boston. What are we doing to advise Uber driver to report to the hospital and they go to the airport or some other location?
Uber drivers, along with any other workers who are in the public setting, have the same requirements in terms of staying home if they are ill, in terms of making sure that their vehicles or other transport mechanisms are cleaned, and that they do what they can in terms of the public that they are interacting with, limiting from crowded situations and making sure that they are able to keep the distance where they can.
Doctor, I heard today from a caller who was concerned that they had been to a donut shop. A person had grabbed a donut using a tissue and did not use gloves. Is there a difference there? Is there a safety factor involved there? And they felt a little less safe because of that. What would you tell food handlers, even though most places are closed, but what would you say?
For food handlers, we have issued guidance that if they are connecting with food that is not cooked, subsequent to that, they should be using gloves. There should be a no contact component with food that is not cooked. So that's guidance that we have for food handlers, and we'll continue to work with them to support them in implementing that.
Doctor, is there any modeling on
I want to be fair about this. There are a lot of folks who aren't here because they're heeding our advice to avoid crowded spaces, so I want to answer a few of these and then we'll get back to you. By the way, the answer on the swabs, the testing, I want to be clear. We have a number of testing sites all over the state. We have drive-through sites. We are very capable of setting up more sites. The National Guard is doing an awesome job at this. The issue is the swabs right now. You need a swab, a special kind of swab, as the doctor said, in order to take the test. Like the example I use is a strep test, the swab. So that's why I'm putting out this call to everyone to say, help us find the swabs, because at the moment, that's the key that we need. And to the many, many people who want to know when's this all going to end, and to your question, Brian, when we get to a place like you're seeing in, say, South Korea, where you have an ability to do massive amounts of testing, even on asymptomatic people, and then appropriately quarantining them, that's the place you want to be, because then we can start thinking about potentially changing some of the the extreme social distancing measures. So I'm just saying that to give folks a feel for kind of where we're trying to get. It's not where we are today. And as I've said many times, because the federal government was so totally unprepared for this, and we are not getting the support that we need in terms of the medical supplies that we need, it's on us, governors and mayors and health directors, to scramble to do what we're doing, which we are doing. And right now, Rhode Island's, I read, testing more people per capita than any other place. But we're trying to ramp it up. And as for the priority, you can imagine if you're someone in a hospital, in an isolation room, we need that person to get tested quickly. So if they're negative, the isolation room can be freed up. So I'm just sharing some of the complexities of how the system is being managed. Questions that some of your peers have emailed into us. Question for me, are you reconsidering the Friday deadline for restaurants to remit their sales and meals tax? The answer is no. The deadline is tomorrow. If you have a particular hardship or you need a little extra time, call the Department of Taxation. I believe I misspoke yesterday and said call the Department of Business Regulation. I apologize. It's taxation. It's the place you'd normally be going. We have some extra resources. But again, I want to be clear. This is for the sales tax that the customers have already paid and that you're holding in escrow. So remit it by the deadline tomorrow, please. And if you have some extraordinary circumstances, give us a call and we'll help you out. We'll work you through it. Secondly, has the state stopped paying any contractors due to the crisis? The answer is no. The state is paying swiftly. If anything, we're trying to pay more quickly so we can help out the local economy to the best of our ability. And I'd like to thank Brett Smiley, who's the Director of Administration. But if you're a vendor to the state, we're paying on time, and we're going to continue to do that. Next question for me, any updated guidance for independent contractors who are out of work due to COVID but ineligible for unemployment insurance? This, the answer is we are working with the federal government. The federal government needs to respond to this. We don't have a state mechanism in order for that to happen. And I know that's unsatisfying, and really for these folks, my heart goes out to you. So we are working literally every single day to get the Congress to pass some additional relief for you, which I believe will be coming. I've been assured by members of the administration and by our own delegation that this is firmly on their radar, and they're going to try to have some essentially emergency. What we need is a federal government emergency unemployment insurance for independent contractors. Thankfully, the Congress passed and the President signed a stimulus, which we are getting under the covers of right now, which will provide sick leave and expanded unemployment insurance and family medical leave. So, of course, we're going to be doing everything we can to make some announcements in the coming days around how folks can have access to that. And then there's a few questions for you.
So how many ventilators does Rhode Island have in its stockpile? And do you have a plan to increase the number of ventilators to operate them? We currently have 200 ventilators in our stockpile. We are among the states that are better prepared from that standpoint. We are absolutely looking for ways to continue to increase it as well as maximize what we have available.
Does that include the military?
Yes.
The 200 includes the
It includes what we have access to as the state for Rhode Island. Does the Rhode Island Department of Health believe hospitals and doctors should implement across-the-board cancellations and rescheduling of elective procedures at this time? It's something that we are evaluating on a day-by-day basis. The hospital CEOs understand the importance of this and are looking at a phased approach for addressing it, and it's something that we are continuing to assess every day. Based on the limited testing in the state, how many cases do you believe we actually have? This is something that every state is challenged with, particularly given the scenario that we just described. So we understand that there are likely more cases out there. We do want to do what we can to protect the most vulnerable. Right now, we want to make sure that the other cases who may not have tests done but have similar symptoms and have the same treatment are very clear on what they can do regardless. And as we get the supplies to come in a steady influx, we will be expanding testing and continuing to strengthen and expand our extensive contact tracing program that's in place.
Doctor, not to belabor that testing point, but we are getting a lot of questions. You know, people are calling their doctor, they're saying, no, you don't qualify, you don't test. What do you tell those people to assure them? And again, they're concerned about now who should around them be self-quarantined again. I don't want to belabor it, but a lot of the questions are focused on that, and I can't even get a test. Again, my test results have taken days, even people who work in the medical profession.
Absolutely. It's something that we very much understand. The governor has been on the front lines in addressing the supply issue that has contributed to this. Our focus is to make sure that people who have symptoms understand what to do. If you have symptoms that are similar to an influenza-like illness, because we have community spread in Rhode Island, consider that similar to a COVID-19 presentation. And if you are ill, you should stay home. You can let the people around you know so that those who are around you are aware of monitoring themselves for symptoms as well. We want everyone to stay home, which fulfills that quarantine approach. And regardless of if a test is done or not, using the supportive treatment tools and services that are available, making sure that people are drinking fluids, they can recover safely at home, use good cough etiquette, fever-reducing medications are still the same approach, whether COVID-19 or the flu. We want to help people really understand that even if it is the flu and a COVID-19 test were to come back positive, still take this just as seriously and have the same response in terms of staying home and letting those around you know as well so that they can monitor for symptoms and follow the instructions to stay home as well.
Last question.
How many,
Governor, yesterday we were told by the mayor and public safety commissioner in Providence that they had shut down a half dozen establishments that were violating the orders that they not operate. What have you heard from other communities? How serious a problem is this? Is it going on elsewhere? What do you tell them?
Yeah, so first of all, I want to thank the mayor for doing the right thing. That's absolutely the right thing to have done. And so, thank you. We haven't heard too much of that. You know, we're hearing a little bit of bad acting, fights in parking lots of grocery stores, a little bit of price gouging, examples of, you know, like I say, people sneaking into nursing homes. And I understand. I mean, this is a really tense time. We're asking a lot of people. We're asking people to sacrifice a lot at a time when they're stressed. But we are serious about it, and we're going to enforce all these rules. So we talk to the mayors every single day. We're not hearing too much about it. And where we do hear about it, like I said, it's mostly isolated, and the Colonel of State Police is in touch on a daily basis with the chiefs of police. And we're in touch with the mayors, and at the moment, it's all pretty manageable. I want to say one last thing about the testing. We're not where we need to be. We're literally getting better every day. The more swabs we get, then the more commercial testing is available, the better this will be. So we're doing the best at the moment. Ask for a little bit of patience. And it's probably worth reminding everybody the protocol. If you feel sick, call your doctor. Please don't call 911. If you don't have a doctor, call the Department of Health. We continue to put more people on the phones here. And then they'll triage you and figure out how to get you to be tested. So I understand it isn't where we need to be, so please be patient. It'll be better tomorrow than today, and better Saturday than Friday.
Thank you,
How many of the cases are healthcare workers or any state employees among the positive cases?
I'll get back to you with that information. I want to make sure that we are accurate and then also careful in protecting the privacy of people. Thank you.
Thank you, everyone.
Supermarkets, I know a lot of stores continue their hours to senior citizens. We heard that got crowded, and then they didn't have some of the food that people are looking for. What do you say to senior citizens who are looking to shop? And I know people are trying to do the right thing with those hours and trying to figure that out.
You know, we're dealing with a highly imperfect situation, to say the least. So I would say just please be patient and do your best. Here's what I know. I know if you're 60 and above, it's much more dangerous to be in a grocery store that's crowded than it is to wait a day or two for the particular food that you want. And grocery stores are working as hard as they can to restock the shelves. So use your common sense and avoid crowded places. By the way, if you have a loved one in your life or a friend or a neighbor or a colleague who you know is elderly, pick up the phone and call them and give them a hand. Maybe you could go to the grocery store for that person so they don't have to. We'll be back tomorrow. Thank you.
And we are coming out of a news conference at the Department of Administration in Providence with Governor Raimondo and our health director as well. Just to recap some of the key highlights. Again, there are 11 new reported cases in Rhode Island. They range in age from their 20s to their 60s. One of the people involved here is hospitalized, and that brings Rhode Island's total now to 44 cases. Dr. Nicole Alexander Scott says they'll begin releasing cases by county soon. That's a request that our reporters and others have made. And again, she says that they are not surprised that they're seeing new cases because they are ramping up testing in Rhode Island. Governor Raimondo also says right now she's not planning to order any sort of shelter in place, but reiterates it's important for people to stay home if they can. Governor also says right now the state is working for the best, saying that what has been done so far is paying off, but they also are preparing for a surge in cases. And she says overall she hopes the preparations continue to go as they are hoping. She also says the state is focused on getting swabs for testing and protective equipment like masks and gowns for our healthcare workers. So she's putting out the call to some of our textile manufacturers, labs, dentist offices and others to provide some of that protective equipment if they can. Department of Health is also going to put an online form. It will be on there at 3 o'clock this afternoon with more on what they're looking for. She also reminds us that the AG's office is responding to instances of price gouging. She says any of this should be reported to the AG's office immediately. It is illegal, and telling anyone to do it, if you see it, to knock it off. Governor also says people should not be concerned about banks and credit unions, saying that there is plenty of cash, advising people to get cash from outside ATMs if they can instead of inside the lobbies, and that people should not worry about evictions either because she tells us courts are closed until April 17th at the earliest. Dr. Alexander Scott also says testing is focused on some of the prioritized populations, and they're working to expand that. And the governor reminds us there are several testing sites, but they can set up more, but they do need more of those specialized swabs first. She also wants to tell us things are getting better every day, but not exactly where we need to be. And again, Dr. Scott telling us right now there are no cases at the ACI. You may have heard yesterday the Department of Corrections saying that there were 3 inmates at the medium security facility that were being tested after showing flu-like symptoms. Now, the state does have 200 ventilators in its stockpile, and we understand Rhode Island could be in better shape than other states in that regard. Once again, Governor reminding you not to go visit nursing homes as well because we want to protect those who are most vulnerable. And right now on our website and the WPRI News app, we have minute-by-minute updates on cancellations, school closings, and much more. You'll find that at the top of our homepage. Thank you for joining us for this special report. We'll see you tonight, live at 5 on WPRI 12.
Stay with Eyewitness News for the latest on this breaking story.